Hello, everybody. Welcome to today's episode of On Becoming a Healer. This is Saul Wiener. We have with us today John Scala, who has interviewed on our show before. We did 2 sessions with him, actually a 2-part episode. John is a physician in solo practice in Colorado, and I thought about him after hearing about the importance of primary care physicians in addressing vaccine hesitancy. What we've learned at this point is that fewer and fewer people are lining up to get vaccinated, and among those who are hesitant, many look to the individual who they trust most, which is the primary care doctor. John has a very devoted following of patients and an enormous amount of experience and has been really in the middle of this whole business of trying to address concerns patients have about participating in the COVID vaccine program. So I have some questions I'd like to ask John, and John has been kind enough to join us. John, thanks for being with us here today.
Yeah, thanks for inviting me, Saul.
So John, I'd just like to start with some data. Can you tell me a little bit about roughly the rate of COVID vaccination in your community as you understand it, and then also what it is now in your practice?
Yeah, so Colorado, I think, has distributed in the neighborhood of 2.5 million vaccines, and we have a state population of 6 million people. But, a certain percentage of those are children that don't have access to the vaccine. So we're actually, I think, doing very well in the state. So that's good. In my practice, almost all the seniors have been vaccinated, and the young people, the young adults, the vast majority of them are vaccinated. And I think it's probably in the 90% range, but by no means is that a good sample because there's some people that obviously I haven't seen over the last 4 or 6 months. But overall, it's been pretty positive, but there's still a certain percentage of people that are hesitant, of course.
90% is just an astonishing number, even though I understand it's not a perfect representation of your overall practice. But can you tell me a little bit about your experience talking with patients who are vaccine hesitant over the last few months? I know that they're not all alike. There are many different reasons why patients are reluctant to get vaccinated for COVID. But can you share with me some of your experiences and what you found to be effective?
So some people just want to wait because it's a new vaccine, and they're willing to wait until the summer, until more vaccines are out, until we get more long-term data. And for those folks, a lot of them, I'll say, look, we've given out, 800 million messenger RNA vaccines throughout the world. I said, it's really unusual in medicine to get a sample size that large. and they think about it and they're like, oh yeah, okay. And so some people are so resistant that they're not going to do it right away. But I think because we're face to face, in order to please me, they're like, all right, you know what? I'll do it in a couple months. So, it's not a flat out no anymore, but they'll do it sooner rather than, right away. And so that's a little encouraging. And I don't know how many of those folks are saying that just because I'm in front of them, and how many actually I'm starting to change their minds slightly. So there's that group of folks that are just waiting. I've gotten a lot of talk about how the messenger RNA integrates into our DNA and changes our bodies. And so that's a whole thing that we have to explain, and some of that's on my website. I tell them, these are precision vaccines. I said, in my opinion, all the vaccines should be like this. And in fact, once we have this technology down, I can easily see all the old vaccines being reformulated to messenger RNA. It just hadn't been proving on a large scale to be able to do it in the past. It wasn't cost effective. And I explained how it just stays in the cytoplasm and we just translate the protein. But basically, it's a way to explain that, this is actually the best way to make a vaccine because it uses body to make a very precise protein to make your antibodies against, rather than injecting a different type of virus that's carrying part of the COVID virus. So once you start explaining and they get off the internet and they understand that it's not altering their DNA or even integrating into their DNA, I think maybe some of the change occurs, but there's a whole lot of misinformation out there on the internet that's really interfering with our ability to achieve a herd immunity through vaccination.
Now, I've heard stories, anecdotes of primary care physicians having really in-depth conversations with patients who are vaccine hesitant, where they answer question after question after question, and still the needle doesn't move. The patients still opt not to have the vaccine, even after extensive exchange about the risks and the benefits and so forth. Tell me a little bit about what that's been like for you. Are these very long conversations? And it seems as if you've been more successful than many of the examples I've heard of physicians who are very patient and seem to do everything they can to address their patients' concerns.
Right. So, I don't take that much time because usually the visit is for something else or the phone call for something else. And, it doesn't frustrate me. The folks that don't want to be vaccinated, they're the ones at risk. I'm not at risk. And the other vaccinated people aren't at risk, except in the case of vaccine failure, of course. But, just like anything else in my practice, I tell them, I'm like, look, it's your life. I'm like, you're paying me to use my knowledge and experience to help improve your life. So, it doesn't bother me and it doesn't frustrate me. I just try and give the information. And they know that they're safe when they're talking to me. They know I'm not going to look at them any differently if they choose or not choose to vaccinate. We're still going to have that good relationship.
Now, there is, of course, the impact on public health if many Americans choose not to be vaccinated. So, of course, it's not only an issue of safety for the patient themselves. There's a public health dimension to this as well. Many people feel like, or many experts think that we're not going to reach herd immunity because of the high rate of vaccine hesitancy. And that's become a major concern. So how does that factor into your thinking?
In terms of the herd immunity, I'm well aware of that, Saul. And, the problem is if you start pushing too much, then they just shut off. So it has to be kind of an evolution over maybe several visits and several talks to try and convince them in numerous ways. So I try and use different avenues. There's some, Colorado, if you haven't been out here, there's some interesting viewpoints. So there's this, we're always looked at as kind of a blue state, but there's a pocket of these fiercely kind of independent, strongly Republican, very conservative views. And so for them, I try and have them start thinking of the big picture, like almost outside of themselves, instead of these little groups that they're associated with online and so on. Some of the older folks, hey, the entire world watched the moon landing, and that was a big American event. And there's still a lot of pride worldwide from that one event 50 years ago. I said, this is our time. I said, this is our time where, for numerous reasons and different, investments over the years, the Americans have produced this phenomenally effective vaccine. And I say to them, I'm like, in 20 years, don't you want to tell like your kids and grandkids that, I was part of that. I was part of this big American medical experiment and transformation that propelled American medicine forward. And, I think, I don't know the results of that, but I read both sides of all the issues, and I think that tweaks a little bit of the nationalism, like, okay, yeah, I might want to be part of that and look back and say I was part of that.
You've mentioned to me in the past that this issue of vaccine hesitancy with COVID is just part and parcel of the whole issue of patients having ambivalence about vaccinating themselves and their children. And that, of course, all of us who practice pediatrics have dealt with this issue for years. And so let's widen the lens a little bit here and just maybe step back from COVID specifically and talk a little bit about your experience with families. And in this case, I know you're both a pediatrician and an internist, so just putting on your pediatric hat here, your experience with families who are hesitant to vaccinate their children. I know some pediatricians are reluctant to take care of families who are vaccine hesitant, who won't vaccinate their children. So tell me a little bit about your attitude when you have parents who don't want to vaccinate their children and how you approach that.
Yes. So the way it seems out here is there's like two groups of pediatric providers. The first set are the kind of standard pediatricians, and most of those practices, they won't accept into their practice families that won't vaccinate their kids. And then there's kind of this alternative set of pediatricians that seem to cater to kind of the alternative medicine, homeopathic, and no vaccines. And so I've always been of the thought that, it doesn't have to be one or the other. And so I accept families into my practice that don't want to vaccinate their children. And the reason for that is because if all of us, say, standard pediatricians, deny these kids access, then the only options the family have is to go to these kind of alternative pediatricians that are against vaccinations, and then they're not even given the opportunity to vaccinate. So what usually happens is, they're like, oh, no vaccines at all. And then, it's 2 months visit, 4 months visit, 6 months. And, it gets to be 6 months. The family knows me. They're getting to know me better. And I'm like, look, I don't want to do a spinal tap on your kid. So let's at least give the Prevnar and the HIV vaccines, right? Remember how many spinal taps we used to be in the 90s? It was like spinal taps all night long.
Oh, yeah.
Right. And I talk to them and stuff, and they're like, okay, these are conjugate. They're pretty benign. It's not diphtheria. It's not measles. All right, let's give the HIV and Prevnar. And so that's a really common outcome for anti-vax families is, okay, bacterial meningitis, I can see that. We'll do those vaccines. And then slowly over the next, 6 months, 12 months, 18 months, I kind of be like, look, your baby's developing normally. Maybe we can protect them against whooping cough or, polio or whatever. And so that concept's worked out pretty well. I just had a family recently, and they said, we don't want to give our kid MMR until after 3 years of age. They said, we'll give all the other vaccines. I'm like, that's fine. And so after they came and the baby came and we got to know him for a while, I'm like, let's try this. I said, I know you don't want to give the measles shot until after 3. I said, but if there happens to be a measles outbreak in this country, then you come in and get it. And you know what? They agreed to that. They thought that was a fair compromise. So there's a lot of little things we can do to compromise without completely kind of stonewalling them and giving them the opportunity over time to maybe consider other possibilities.
I think that one of your strengths, John, is that you're not judgmental. And I have to kind of tip my hat to this because, many of us, me included, tend to get angry when our patients won't get vaccinated. It's something we may be pretty good at hiding, but we still feel it. And I'm just curious about your thoughts on this question of being judgmental or not judgmental. I mean, I get the sense that when your patients don't want to get vaccinated or they don't want their kids to get vaccinated, you do what you can to help out, but it doesn't seem like you lose sleep over it. It doesn't seem like it gets you angry towards them, or it doesn't seem like it makes you think less of them. Is that the case? I mean, does it change the way you think about them at all?
No, not at all. Because it's actually, for me, it's actually kind of interesting to have that kind of view. And I think I've told you before that the whole anti-vax movement, there's really no. It's just like a belief. It's like a religion, and nothing you can do can really change it. So there must be some either subconscious like fear or maybe lack of understanding or somehow not in control of, their own family. So there's something in there that's bothering people that they could believe blindly in this sort of religion of anti-vaccination. And so it doesn't bother me at all. I try and understand the family. I try to understand their fears. And then I try to find little inroads that maybe I could convince them, similar to the HIV and Prevnar with the bacterial meningitis, to at least get some of the vaccines in. I mean, the last thing I want to do is send a kid to the ER for a spinal tap.
Mm-hmm, mm-hmm. So I'd like to talk a little bit about how trust develops between the doctor and the patient over time, whether it happens at the first visit, whether it takes a while. I know you've had many of your patients with you for a number of years, and I know that there's a very high level of trust, which is critical when you're talking to them about something new like the COVID vaccine. But can you talk a little bit more about how trust develops? You did say just now that part of it is just talking straight to people. I think that is an important part of it. But do you have any other thoughts about what creates really trusting relationships between you and your patients, therapeutic relationships? When you meet a patient for the first time, what do you think are the characteristics of that interaction that are likely to grow trust?
That's a wonderful way to put it. And I have been seeing a relatively large number of new patients, even though I'm so far into it, because the volume has been down so much. So every week I'm seeing 3 or 4 new adult patients. And so when I see a new patient, there's all the medical stuff on the side, but the first 10 minutes, I'm just interested in them. I want to understand who they are and what kind of person they are. So we talk about, if they're working and if they're married and if they have kids and where they grew up, how they met their spouse. you know? So we just kind of shoot the breeze for the first 10 minutes so I can get kind of a full understanding of the person's life picture. And then after that, we go into some of the medical stuff, or if they're having any problems, we can talk about that. And I think that really relaxes people when they first come in, because it's a new visit, so they're all wound up to meet a new person. Plus, it's a doctor. And here we are talking like we are sitting together on a park bench and we just met each other, right? So we give a good 10 minutes or however long it takes, and people love to talk about themselves. So if you give them the opportunity, they'll talk, and you'll get all these details. And it's kind of fun because, the doctor's in there. He's like, well, how'd you meet your spouse? Like the one guy I saw a couple of weeks ago, he works at Whole Foods. I'm like, how'd you meet your spouse? He's like, we were working in the same store. She was in bakery and he was in produce. And after they got married, they had to go to different stores because of company rules and all this. So that was a lot of fun. And so that breaks the ice, and it gives them this impression, which is true, that, I really care about them more than, if the blood pressure's high. I want to see them, how they live at home and how their life goes. And so that first visit's very important that way. I do all the first visits without any residents. So it's just, the patient and I. And then after that, we expand on it. And I've done that. I've mentioned in a previous podcast, the first thing I do, as long as they're not acutely ill, say it's a regular visit, I'm like, oh, how's your son doing? He must be in 4th grade now, or, how's it going at Whole Foods, or this going or that. And again, that kind of breeds that kind of familiarity, whereas they're like, oh yeah, this guy, he's just not the typical cookie cutter medicine, this fractured medical care where, everyone's just looking at this little piece like my blood pressure and I'm out the door in 10 minutes. Well, no one wants to be treated like that for the primary care. And that's why I think, when these big things come down, like this pandemic, there's a lot more just inherent trust. Like, all right, if doc says, we should get the vaccine for the, general society, that's probably a good idea. So it's been very successful that way, I think, in a health emergency like this. So
yeah, that's a good explanation. Just want to ask you about how it affects the time pressure of the visit.
If I do kind of run out of time with a new patient, I'll be like, look, I said, I'm gonna review all this information and read through it, and I might call you later today or tomorrow and clarify some details.
Yep.
You see? And so that way we don't get too out of whack, and I don't get too overwhelmed with like too many things at once. And it really makes the patient feel important. Like, all right, he's going to look through all this and try and analyze it. I mean, they know it's complex if it's like that. They know they're putting a lot on me. And then when I say, okay, I'm going to review it and call you back, they love that. Like, he's going to really analyze it and give me a call and clarify some stuff. And so that works out great, because that way I'm not time pressured. I can call them after hours. And they really respect, patients really respect when you do that. And luckily it doesn't happen that often, but when it does, you can build all the trust you need just from that extra phone call.
Yeah, and I think that pays off when you have a pandemic and you need to ask patients to consider interventions, changes in their life, things that they're not used to. That's where the trust pays off.
Yeah. I mean, I agree with that. There's lots of little things we do here that help. If a kid comes in with a sore throat and it's strep, I'll write the extra script for the other kid at home in case, they get sick over the next couple of days. So there's just lots of little things I don't even think about that just helps with everything. Saves people money.
Now, one challenge with the whole vaccine process in primary care is that primary care doctors have not actually had the vaccines in their office. And that can be a problem when you're kind of taking the lead in talking to patients about the importance of getting vaccinated and then not actually being able to vaccinate them. Can you talk a little bit about that?
Right. So there's a certain percentage of people that don't trust any vaccine unless I give it to them. And that goes for all the vaccines. Like, they could get something for half the price through an insurance benefit at the pharmacy, but they'd rather pay cash at my office. Similar idea. And as I'm talking with some patients in the office, they'll, even though they're resistant, they'll turn around and say, "Do you have the vaccine here?" And I'll say no. And they're like, "Oh, okay." So even these vaccine resistant, they might have that quick thought like, "Oh, I can just get it done in my doctor's office." Right? And that would have been one extra person I could have done, but I haven't had that opportunity yet. So And so just this week, we finally got something from the Colorado Department of Public Health saying that, you might be eligible to have, we're going to start putting the vaccines out in the primary care provider.
So one perhaps final question for you. There are extreme skeptics out there and people who just seem like they're quite resistant to getting vaccinated and nothing seems to change their mind. Often it's associated with certain ideologies like evangelical conservatives, for instance, are considered to be a group that is very resistant to getting vaccinated. And I'm curious about whether you think that the very high level of trust that your patients tend to have in you and the length of the relationship is going to make any difference, or whether you think that it probably won't make any difference and these individuals are just not going to change their mind.
Yes, so there are going to be always those groups, Saul, and I think even with a high level of trust in me, these certain, I wouldn't say cult, but, extreme kind of belief type systems will always supersede what I say. And I'm okay with that. I think what could make the difference and what possibly in the future might make the difference is an extremely dangerous variant. If we happen to see, with all the uncontrolled spread throughout the world, a kind of super variant that, for instance, injures or sickens or kills children specifically under 15 years of age, I think there'll be a major shift in what everyone thinks.
So if I were to summarize what I think your perspective is as a primary care physician, I would say the following. I think that you approach your patients with curiosity, with a desire to get to know them, to take pleasure in forming connections. And whether they decide not to get vaccinated, even when the risks are very low and they have lots of risk factors, is not going to change the way you think about them in terms of whether you respect them or not. It may heighten your concern for them, but it doesn't cause you to judge them. And you tend not to lose sleep over that. In other words, it seems like you don't feel a strong need to control what your patients do. You understand that, as you say, they're going to make whatever decisions make sense to them. And I think that kind of attitude is critical to enjoying primary care. I think that if we go crazy over the fact that our patients are not acting what we deem to be rational all the time, then that's just going to kind of burn ourselves out. There's a connection between the joy you take in practicing primary care and the fact that you don't get too exercised about the fact that people don't always act quote unquote rationally.
That's a fair assessment, Saul. We go into it to change the world, but I think, just as I like to say, smoothing off a corner here and polishing a corner here tends to be more rewarding long term than some kind of huge goal of changing everyone. And, everyone's an individual, so, you got to look at them like that. They're not this big pool of people that we're trying to get herd immunity. They're all individuals.
Yeah, and I think that outlook enables you to take pleasure in the little victories when you are successful, but not to lose sleep and gnash your teeth when you're not.
That's correct.
Excellent. Well, on that note, thank you very much, John. That was really insightful, and it was nice to get your perspective as a primary care physician in the heartland on getting to know your patients and how that's related to building trust and then ultimately making at least a small difference around vaccination and vaccine hesitancy.
Well, thanks for your time. I appreciate it, Saul.
We hope you've enjoyed this latest episode of On Becoming a Healer. If you have and you haven't already subscribed, please consider doing so now. Take care, everyone.